Most videos about finding a therapist give you a list. Check your insurance company, check Psychology Today, done. But today we talk about what it actually feels like to do that for the first time, when you're in the middle of it. There are over 23 million people in recovery in this country. And one of the biggest barriers in getting into recovery is something almost nobody talks about, the terrifying, confusing, shame-soaked process of finding help. Today we fix that. Hello and welcome. I'm a licensed clinical social worker with 25 years of practice in the field of addiction and recovery. I've been sober for over 30 years myself. I've been the person who needed help and didn't know how to ask for it. And I've been a clinician sitting across from many people who found the courage to walk through my door. This video is for the person who hasn't walked through that door yet, or the person who has someone that they love that they can't find the door at all. We're going to talk about the different types of help available, what to ask for before you commit to anyone, and what I, as a therapist, would tell you to keep an eye out for. Things most people don't know what to look for. Before we get into the practical stuff, I want to sit with something for a moment, because I think we skip over it too fast. When you're in the middle of addiction, or early in trying to stop, looking for a therapist isn't necessarily as simple as a Google search. It may be a very difficult thing to do. What I know for me is when I thought about asking for help, that shame was often louder than the desire to get better. This is not a personal failing, it's just part of the goal of the addiction. Remember, the goal of the addiction is to continue to use. That voice may tell you that you are the one person beyond help. It may tell you to wait until you're sure, until you're ready, until things are bad enough. Or it may tell you that I'm the only thing that works for you to quiet that monkey brain. But here's what I've seen in my practice. There is no perfect moment for readiness. You reach out when you can reach out, and that's enough. You don't have to be ready, you just have to reach. All right, so let's talk about the landscape. Because one of the most confusing things is when you're looking for help, what kind of help do you even need? There are essentially three basic types of professionals that you'll encounter, and they're not the same thing. The first is a specific addiction counselor, sometimes called a CAC, a CAC, and that stands for Certified Addiction Counselor. They are specifically trained in addiction. Many have personal recovery experiences. They are enormously valuable, especially in early recovery. What they typically don't do is address the deeper clinical issues, trauma, depression, anxiety, that often live under the addiction. When I think about addiction and mental health disorders like anxiety and depression, a lot of times for me what makes sense is it's just a big bowl of spaghetti. They're all just kind of mixed up. A CAC is somebody who focuses exclusively on the addiction side of things. Generally they are supervised for anywhere between 2,000 to 4,000 hours doing clinical work, and then they sit for their final exam. They don't necessarily need any kind of college, but they do have to show proficiency in certain arenas. The second is a licensed clinical social worker or a licensed counselor. And this is what my credential is. And what we bring is the capacity to address the full clinical picture, not just the addiction, but everything that's connected to it. The childhood history, the trauma, the anxiety that drove us to use in the first place. And what I've seen in my practice is that for sustained recovery, this level of care is often where the deeper work happens. So generally there is the LPC, the LCSW, and the psychologist. With the LPC and the LCSW, they've graduated from a master's level program, and they've spent 2 years underneath someone who does supervisory work with them, and then they sit for their final exam. Psychologist is generally a 4-year doctorate program. The third type of professional you may encounter is a psychiatrist. They're a medical doctor who can prescribe medications. If you're experiencing severe withdrawal, depression, or there's a question about medication-assisted treatment, whether that's buprenorphine or naltrexone, for example, a psychiatrist is part of the team. And I will say, if you do have a psychiatrist, they won't do what's called talk therapy. They're there just to prescribe. So generally your appointment will be 15 minutes long, where they'll come in, they'll ask how your medications are doing, see if they need to tweak anything, but it's not going to be a point of talk therapy. Here's the truth you may not know. For most people, the answer is not one of these. The answer is some combination. A good treatment plan looks like a team, not a single person. And so that team will usually consist of someone who's going to do that talk therapy piece, and if you need medications, that psychiatrist. So that combination of the medication and being able to do that therapeutic work is often what we see as part of that team as we work through our recovery process. Here's where the therapist and me and the patient and me are going to agree on something. That first appointment is not the test. And most people don't understand that they're allowed to ask these questions. Remember, you're hiring a person. They work for you. Here are 5 questions that you may want to consider asking, and I'll tell you what the answers should possibly sound like. Do you have experience specifically in addiction and recovery? Not every therapist is trained in addiction. It really is a specialty that often requires years of experience and supervision from a specialist. You want somebody who understands the neuroscience, the relapse patterns, and understands the importance of the recovery community. The second question is, what is your approach to relapse? This one's critical. What I've seen in my practice is that some clinicians, even well-meaning, respond to relapse with something that feels like a disappointment or judgment. What you want to hear is relapse can be a part of the process, not the end of it. If they can't say that, then you may want to consider keep on looking. Third question, do you use evidence-based approaches? You don't need to know what they are, but you want to hear terms like cognitive behavioral therapy, dialectic behavioral therapy, motivational interviewing, trauma-informed care. These aren't buzzwords, but they're methodologies with decades of research behind them. That being said, the research also shows the most important predictor for success is the connection between the therapist and the client. I get it, I'm not everyone's jam. I accept this and work with the clients. If we can't connect, then we look for someone who they may be a better fit with. And I will tell them, let me know if you're feeling uncomfortable at any point in time in our process, whether that's the beginning or even then weeks into it. If they don't feel comfortable, then let me know. And if we need to figure out something and make those adjustments, then let's do that now. And if we can't, that's okay. And let's find you somebody who can help give you what you need. The fourth question is, how do you handle crisis situations? What happens when I call at 2 a.m.? What's the protocol? You need to know this before you need to know this. Understand they will most likely refer you, if it's an acute situation like an emergency, to seek medical intervention immediately, usually calling 911 or getting to the emergency room. The important is the follow-up. They should work with you on expanding your support network that doesn't focus on a single point of contact, because that becomes a single point of failure. The last question is, what does a typical session look like with you? This tells you so much. A good clinician will describe a collaborative effort process. If they make it sound like they have all the answers and you need just to listen, that's not the model that works in recovery. You need a partner, not a lecturer. I often give my clients the example of me being a passenger in the vehicle. I've got a map, but they're driving, and I can make those recommendations, but ultimately they get to make the decision about where they want to go and how they want to get there. And by doing this, I'm giving them the responsibility of taking care of their recovery. Over time, I've learned that the right therapeutic relationship is the one that you feel seen and not managed. Before we go any further, if this is already helping you think differently about finding support, I'd love it if you would subscribe. I put out content every week that bridges the clinical research with the lived experience of recovery. There's a lot more here that I think can help you. Now let's talk about something most videos won't tell you. I want to talk about red flags because in my 25 years of experience, I've seen clinicians, well-credentialed clinicians, who were not the right fit for addiction work. And I want you to know what to look for. Flag number 1 is they moralize. If a therapist is making you feel judged, shamed, or lectured about your choices, that's not therapy. That's someone's personal opinion wearing a professional costume. Recovery doesn't happen in shame. It never has. But I do want to differentiate being held accountable, which is part of the therapeutic process. When confronted, it should be done with compassion and empathy. Red flag number 2, they make promises they can't keep. Addiction is very complex. Anyone who tells you they have a guaranteed method, that you'll be sober in 30 days, or they'll fix you, is not telling you the clinical truth. What I've seen in my practice is that recovery is not a destination you arrive at. It's a platform you build and continue to do so over time, maybe throughout your life. Remember that you've been drinking over a long period of time, and it's not going to be a light switch where we're just able to flip something and, oh, that makes sense and now I'm sober. It's going to take some time, and anybody that guarantees you that they can do it in a certain amount of time is probably not being honest. Red flag number 3 is they never ask about your support system. Remember, addiction often happens in isolation. Recovery does not. If after a few sessions your therapist has never asked you about your relationships, your living situations, who you go home to, they're missing half the picture. Working with them on developing what your recovery network looks like. Again, we want to get out of that isolated spot. We want to build those support systems that help us in recovery. The fourth one is You always leave feeling worse, never better. Therapy is hard work. There will be difficult sessions. But over time, the overall arc should feel like you're moving towards something, towards clarity, towards steadiness. If every session leaves you more destabilized than when you walked in, trust that feeling. From the patient side, here's what I would add. Trust your gut. Maybe not after your first session necessarily, but by the third session. If something doesn't feel right, that information matters. Tell your therapist how you feel. Can they make some changes? Is there something that needs to be worked on? Ultimately, you're allowed to say, this isn't the right fit. You're allowed to start over. That is not failure. That's you taking responsibility for your recovery and using your own self-knowledge. Let's talk about paying for services. So when we talk about insurance, most insurance plans, including Medicare and Medicaid, cover mental health and substance use treatment. The parity law in this country requires it. Call the number on the back of your insurance card and ask specifically what outpatient mental health and addiction treatment is covered underneath my plan. If you don't have insurance, look up SAMHSA, the Substance Abuse Mental Health Services Administration. Their helpline is 1-800-662-4357. It is free, confidential, and available 24 hours a day. They can connect you to local resources on a sliding scale fee. Community mental health centers are another option. They are designed specifically to serve people regardless of their ability to pay. They're not glamorous, but the work done there is real. In regards to the first sessions, some clinicians may offer a brief consultation, sometimes for free, sometimes at a reduced cost before you commit. Use it. It's a two-way interview. What I want you to know is the cost getting help is real. It's not the only cost though. The cost of not getting help, your health, your relationships, your life, that is also a cost. And that one compounds. Before I close, I want to speak to the person who is feeling overwhelmed right now, because I know that person may be out there. In my practice, I use something called OHALT. It stands for overwhelmed, hungry, angry, lonely, tired. These are the states that make it harder, including asking for help. If you're in one of these states right now, and if you're watching a video, there's a good chance you are. Here's your one next step, just one. Go to samhsa.gov or call 1-800-662-4357. That's it. You don't have to figure out everything tonight. You don't have to have a plan. You just have to make one move in that direction for help. What I know for me is I didn't get sober in one decision. I got sober with 1,000 small decisions. The first one was admitting I couldn't do it alone. That oh halt moment is not a signal that you're weak. It's a signal that what the nervous system does when you're under siege. You're not broken. You're just dysregulated. And dysregulation can be treated. If you understand more about what happens to your body and your brain in early recovery, what I call the first 30 days. I have a video on that and I will link it. Because understanding what is happening to you physiologically changes the entire experience of asking for help. Here's what I want to leave you with today. Finding a therapist, especially for addiction, is one of the bravest things a human being can do. What you are confronted with is trying to walk away from a coping skill that has worked very effectively for a very long time, but is now starting to become a liability. We don't have a replacement for that coping skill yet, and that's pretty scary. It requires you to believe, even just a little bit, that things can be different. That belief doesn't have to be loud. It doesn't have to be certain. It just has to be enough to make that one call. Remember, you don't have to see the whole staircase. You just have to take that next step. The door of recovery doesn't open all at once. Sometimes it starts with a knock. So let's make that knock. If this video helped you, or if you know someone who needs to hear it, please share it. That is how we reach people who are still searching. Subscribe if you want to keep going deeper into this work. I put out a new video every week that blends the clinical with the personal, because I believe that's where real recovery lives. I hope to see you in the next one. Take good care of yourself and be safe.